Hello, I'm Dr. Wickham Simonds. I'm an obesity medicine specialist from the Triangle area of North Carolina, and this is Obesity Medicine Perspective. I want to apologize out of the gate for my messy haircut. I'm growing my hair for a charity, and so it's going to be growing for a while, and I'm having a hard time dealing with it. And if you'll just bear with me, those of you who know me, at some point I'm going to get it cut off, and I'll have raised a lot of money for charity. Now, what I want to talk about today is something other than that. I've had a lot of questions about a World Health Organization report that was issued. When you see this video, it will be 2 weeks after the report was issued. And essentially the report is about colon cancer, and it tried to tie the risk of colon cancer to the ingestion of processed meat and red meat. And I've had a lot of questions about that. Those of you who know me know that I target insulin as a treatment of obesity. If you lower the insulin level by eating things like meat, you can lose weight and you lose body fat. And if you've been watching those videos, you know that. And so then the question is, wait a minute, if I'm eating these things, is it unhealthy for me? So I thought I would put it into perspective, because to go back and retrospectively look at people who have ingested processed meat or red meat and then conclude years later, oh, this is what led to their colon cancer, is in and of itself, I think, something you have to be very careful about. In other words, assigning causality to something where you see an association. And so I'm not convinced that there's anything that concerns me about the ingestion of processed meat or red meat and the development of colon cancer. What I teach patients is to avoid these other carbohydrates, and in that scenario we know all sorts of other blood markers of bad things improve when people eat like this. So the only way to ever know this sort of thing for sure is to do a study where you feed people processed meat and red meat every day for a long period of time, and then you subsequently have another group of people who don't eat that, and then you try to tie that to the development of colon cancer, and that study is impossible to do. Well, then going back years later and retrospectively looking back and say, well, this person has colon cancer. Hey, did you eat sausages along the way? And if the person says, yes, I eat them a couple times a week, and then they have colon cancer, you might then conclude, hey, the sausages caused the colon cancer. And that's overly simplistic. It is a scientific mistake, and I don't believe that's the way to do things. So in reading the report, you should know a few things. That your lifetime risk of developing colon cancer, if you're just a regular person, you're not looking at anything else, hey, what are my chances of getting colon cancer in a lifetime? Well, it's about 5 in 100, or 5%. All right. If you then were to eat a hot dog every single day the rest of your life, that risk goes up to 6%. So that's what we're talking about here. We're not talking about some astronomical number. And that is an abstract idea in and of itself. I don't know anybody who eats like that and just plans to eat a hot dog every day the rest of their life. In regards to the red meat, the report says we don't have any evidence to tie red meat to colon cancer. We, the authors, just think that it probably has some association with colon cancer. So that means to me, hey, you don't know, so leave the red meat out of the equation. I don't think the red meat is a problem. Now, there are some other inherent flaws, which I think you know. People eat other things with the processed meat, with the red meat. People eat hot dogs on a bun. They often have potato chips. They often have soda. They often do it in the sunshine. Okay, all of those things can be contributors to this cancer as far as I'm concerned, and we don't know how to separate them out. So the bottom line message is, this is kind of confusing. I don't think it helps me or anyone else at all. I think that if you're eating the way that I've taught you to eat, which is keeping your insulin level down, I have no problem if you eat processed meat or red meat. I don't think it's going to harm you, and I personally am not changing my diet to eliminate these things because of this report. So there's my 2 cents on it. I hope that helps you, and until we talk the next time, I'll give you the tools, you give me the effort, and together we can overcome obesity.